I'm Dr. Stephen Smith. I'm an integrated medicine physician, and one of the things that we hear as criticism about our practice is that a lot of what we do lacks evidence, and that we should be practicing only evidence-based medicine. So I want to look at this with you today. Most of what we call evidence-based medicine is based on a study being done, something to scientifically prove what we are doing is correct. Well, the number of studies depends on the money, and most of the funding comes from big pharma. The government is funding studies now more and more into the natural medicine area. The TAC trial, which was a $30 million trial on chelation therapy, was quite successful. Showed that chelation therapy was very effective, especially in diabetics who had won a heart attack. There's nothing in general medicine that even approaches the effectiveness of that. Other money comes from private foundations, but most of the big studies are funded by pharmaceutical companies wanting to get their drugs approved. Well, the problem with that is only about 5% of the studies that are started are actually reported, and those are the ones that are favorable. What about the other 95%? Well, if they have an unfavorable outcome or their outcome is equivocal, they're just thrown in the trash. And we don't know what this ratio is because they're never reported. The FDA has stepped in and said, well, if you're going to report a study, now you have to record the study so that we can see that you're reporting the good and the bad. No problem. The only thing that's changed is instead of going into the trash, these studies are never finished. The Cochrane collaboration is trying to sort this out. They're a group that looks at scientific studies for validity and helps report them to physicians so that we have the best information. But at this date, this is still going on. And what we need to see happen is that when a study is not finished, then the people funding the study or doing the studies are blocked from doing further studies until they finish and report the ones that they've already got in progress. Otherwise, we're still going to be left with this problem of only seeing about 5% of the actual data. Thank you.